Hi everyone, I'm Jen Laws, Community Access National Network's CEO, and this is CANN's January 2022 HIV-HCV Co-Infection Watch. January is generally a fairly quiet time for many folks as they return from their holiday and resume regular work. For the National Institute of Health and the Biden administration, however, this month kicks off an investment in harm reduction. At the very end of December, NIH published two requests for application. The first to establish a harm reduction network aimed at qualifying and quantifying the efficacy and implementation of existing and new harm reduction policies and services. The second seeks to establish a data coordination center in support of the harm reduction network. The first RFA makes particular note to include infectious disease mitigation efforts, including HIV screening and HIV and HCV linkage care, community naloxone programs, and fentanyl test strips programs, and this is the interesting part, safe consumption sites and decriminalization as areas of interest. While much of the public conversation on drug use and decriminalization has focused on the issue of marijuana use, other areas need attention as well. In particular, drug paraphernalia laws, which criminalize items like test strips. It's important to note efforts around decriminalization only marginally changed the landscape for criminalization impacts, especially in the issue of marijuana decriminalization, which has consumed much of the public conversation. The marijuana industry that's cropping up around those areas in which marijuana has been decriminalized are largely occupied by well-financed white folks, whereas those already disproportionately harmed by criminalization of marijuana are Black. Many efforts to decriminalize marijuana do not address decarceration or reparations of any kind for past criminal charges, only exacerbating these disparities in criminal justice. Overall, this investment from the NIH appears to be good news in adding a more robust research-based background to advocate for policy and program changes. We should be cautious, however, to ensure as we advance in harm reduction work, we don't perpetuate existing criminal justice disparities already mirrored in the nation's lack of health equity. Stay tuned, check in, and watch.